Barnes has diabetic ketone acidosis, which causes osmotic diuresing. So his priority would be to give fluids to replace the fluid that is lost through his polyuria. So with him having a decrease in fluid volume, this makes him the second patient that we would need to go see because of circulation. So what we would need to do first, we know we have to do an assessment first. We would want to get daily weights in order to evaluate our fluid status and evaluate our fluid status pre-fluids as well as post-fluids. Plus, we'll also need his weight to calculate his regular insulin and his potassium. So the first thing we're going to want to do is we are going to want to do a daily weight. Then, because he is so fluid volume deficient, we are going to want to give him fluids next. Then, because he's in a metabolic acidotic state with hyperglycemia, we're going to want to first check his blood sugar, again to evaluate where we are pre-treatment and then post-treatment. So then start his regular insulin. This will help correct metabolic acidosis as well as our fluid volume as we are replenishing, as we're correcting that metabolic state. Then we know when patients come in diabetic ketone acidosis, because they're in metabolic acidosis, we are going to need to first monitor for hyperkalemia. And then as we're correcting that acidosis, the hydrogen ions are going to leave the cell and the patient's potassium will decrease. So first they start out in hyperkalemia, and then as the treatment plan is progressing, they will become hypokalemic. So we would give potassium fifth.